Hi everyone. So I want to talk a little bit just about like clinical practice and the implementation of nursing theory into it. So the first thing I want to talk about is why we should use theories within clinical practice. So I think like one of the biggest reasons why we should use it is because it's been shown to be effective in improving patient outcomes. As nurses, our number one priority should always be to place the patient in the best possible position for them to heal, right? So if we're doing that, the evidence does suggest that using nursing theory will help achieve that. So Jonas and Quennell 2019 found improved patient outcomes when nurses used nursing theory guided interventions. So in that review, they reviewed numerous different studies, including randomized control studies, quasi-experimental studies, and more. And they found that of the studies that they reviewed, 26 of them determined that nursing theory guided interventions were useful. 9 of those studies found it to be somewhat useful, and not a single one of the studies found nursing theory guided interventions to not be useful. In a second, I'll go over like what specifically they targeted, but that's huge. That's a huge finding that implementing nursing theory is proven and shown to be useful within a clinical setting. McRae, another reason that I believe that theory should be implemented in a clinical practice is because, as McRae 2011 states, theory legitimizes and differentiates a practice. So if as nurses we don't have a theory that we use to guide our practice, by default we're gonna be guided using a medical theory or some other theory that we're told or um, instructed to use. Not only that, but in the theory, it differentiates what we do as opposed to other professions. So without that theory, perhaps some of our tasks and duties that are nursing specific can be delegated to other people, and then it becomes ambiguous as to whose that duty truly is and what our role and purpose is within the healthcare setting, especially with how widespread nursing has gotten now since it's leaving the hospital, going to public health and all that stuff. Nurses need to have a good understanding of what their role is, and the medical profession as a whole needs to have a good understanding of what our roles is so that we can establish ourselves as a primary entity within the healthcare system. The next thing I want to go over is, does theory make a difference in care? So like I said, in the Jonas and Quennell 2019 review, the study found that nursing theory is useful in practice. So I wanted to expand a little bit more into that. So out of the studies that they reviewed, 3 of them were considered strong based on their review criteria. And of those, they found that the implementation of nursing theory guided interventions improved the rates and amount of fatigue with multiple sclerosis patients. Another study was able to improve or positively affect coping strategies for veterans with limb amputations. And then a third study was able to improve and accelerate the use of guided imagery to decrease depression, anxiety, and stress rates of people who have some sort of depressive disorder. So I think, although those are only 3 of the 35 articles that Jonas and Quennell reviewed, those are pretty big findings that the 3 of them found. And so it does, just like I said, go back to reinforce the fact that nursing theory guided interventions and the application of nursing theory into clinical practice is useful and does have positive, quantifiable improvements within the healthcare settings. How would we know if a nurse is using theory to support working with the patient? I don't think it'd be very overt. I don't think it'd be something that right off the bat you notice, but I think over time you might notice. I think one of the big indicators may be like nurses that really dig deep and try to get to the root cause of the problems. So Jonas and Quennell 2019 gave an example that a traditional nurse who just abides by the medical definition of what a nurse is may classify a patient who isn't taking their medication as not compliant. However, a nurse that is using some sort of nursing theory guided interventions might identify that the patient's not taking their medications at home, and then try to dig deep and look for barriers that are preventing them from taking those medications. And that identification and digging deep is probably indicative that they have some sort of theory behind them, that is supporting their practice. So I think that's kind of the ways that we would identify people who are using theory to support their practice. Ways that we can identify that a nurse is not using that theory is, when we identify nurses that are just complacent and approach nursing with like a medical or traditional nursing mindset, where they just fall back to the organizational structure of the hospital and follow it. So, a big part of nursing is advocacy for the patient. And so even if, the provider recommends something, but we identify that it could be harmful to the patient, it's our responsibility as nurses. And I think it would be a nursing theory guided intervention to advocate for that patient and say, hey, this is detrimental to the patient and this is why. Someone who's not using, nursing theory guided interventions may just fall back and say, hey, if the provider ordered it, we're going to do it. That's what we're supposed to do. So I think those are some of like the subtle ways that we may notice differences between nursing theory guided interventions and nurses who aren't using theory guided interventions. How could theory use in the clinical setting impact nursing quality, safety indicators, and patient outcomes? Well, I think first of all, if we do have the implementation of nursing theory guided interventions, as shown by Jonas and Quennell 2019, we will have improved patient outcomes. So that will improve, nursing quality and safety and patient outcomes. Another reason is, depending on the type of theory, like for example, if you're using Swanson's theory of caring, the patient will feel cared for, which has at least according to the theory, has an impact on healing and will also get improved patient outcomes. So I think depending on the type of theory that's implemented, you'll have different responses by the patients. But I think you'll definitely see and experience quantifiable differences depending on the type that's implemented. When there's clear evidence that implementation of these, theories has a positive impact on nursing and on patient outcomes. And so I think the question to me is like, why is it not more relevant? Why aren't more nurses using theory? And Shogi et al. 2019 found that one of the main reasons why is that there's a disconnect between theory and practice. And some of the recommendations are one, more education within the educational system and the hospital regarding nursing theory, and two, more implementation or development of middle range theories that can be applied to the actual clinical setting, because a lot of the theories that are out there are very abstract and grand scale theories. And so if we're able to have practice-based theories, they'll be easier implemented into, everyday practice. So those are just some of the thoughts that I had about, implementation theory into the clinical setting. If you have any questions or comments, please feel free to leave them in the comment section. Thank you.